and that being that HIV is a condition that impacts in a major disparity young Black men who have sex with men, young Black men who have sex with men, particularly across the South. It impacts people of trans experience. It impacts Black women, impacts all these people in different ways. And it's further exacerbated by just the construct of stigma, right? And just how stigma just rears its ugly head in so many of these spaces. And so a lot of times, the reason why there's not as much advocacy and not as much like good that you hear coming out in the world about HIV is because HIV has been stigmatized so incredibly bad, right? And so I think part of my own personal process is really just starting with empowerment, right? Just starting with recognizing and seeing people just as they are.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Darnell Barrington. Darnell is a senior program analyst at the National Association of County and City Health Officials, or NACCHO. He's an experienced community and behavioral health specialist working to impact community-level solutions. He conferred a bachelor's in psychology at Virginia State University, then a master of public health at the University of North Carolina at Greensboro. In today's episode, you'll hear and learn more about the importance of personal identity in public health advocacy and why representation is vital for effective advocacy, why community engagement is crucial for effective public health initiatives, the importance of capacity building in community organizations and leaders to effect systems change, and why we need to build trust and engage with communities by listening to their needs first, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Darnell Barrington, and I am a HIV public health advocate, and you're listening to Public Health Careers.
Welcome to the show, Darnell.
Thank you. Thank you for having me.
It is my pleasure. As we were sharing earlier, it's been a long time coming, so I'm glad that we could finally make time to chat and connect and hear more about your public health journey.
Listen, I appreciate you for bearing with me. Listen, I'm always on the road, going somewhere, talking to people about public health all across the country. So it's really good to be in a stable place to be able to have this conversation with you today.
Yeah, I absolutely understand that, and I know the challenges of being a public health professional and what that could take sometimes. So glad that we could find time. And I guess jumping into things, how do you identify and tell us a little bit about your personal background?
Yeah, so because my personal identity and my background is so entrenched in what the work that I do in public health and sort of my advocacy work, I'm always leading with that in the many spaces that I go in. So I tell people all the time that, introduce myself as Darnell Barrington. And I am a young ish now, Black gay man who was raised in the South, who is an advocate for access to healthcare for all, access to better systems of public healthcare, and just really always leading with that and recognizing that my identities and how my own intersections like show up in different spaces and how important it is for me to be able to be a voice, particularly for people who don't always have the opportunity to sit at the table. So my identities and how I show up is so critical to my space in public health.
Yeah, absolutely. Couldn't agree with that more. And I think it is so important, like just bringing our own personal lived experience into the work and what that means for many times in the communities that don't have a chance to share or don't have a voice to share. It's like, how can we position ourselves to support those communities? So where in the South did you grow up?
So I'm originally from Norfolk, Virginia. And so I was born and raised there. And for my college years, I went over to Petersburg, Virginia, just south of Richmond known to be the capital of the Confederacy, right? And there's a long historical context there of, just the inequities amongst like people of color and people just of marginalized backgrounds. So just recognizing that it was important to, though, like get away from the environment that I was brought up in, but also recognize that I had a place as far as like being able to give back, almost like a responsibility, I would say, to like be able to give back and to be able to make sure that I'm taking up space in places where my own gifts could be utilized for the benefit of the folks of those communities. So yeah, so I'm a Virginia boy, born and raised. We kind of go back and forth about whether that's really the South. We call it, sometimes we call it, the top of the South, the bottom of the North. So it's that kind of thing. So I think maybe that adds to the strengths and what I bring to this work sometimes is that I have different different, I guess, perspectives of what it looks like to navigate systems across the board.
Yeah, absolutely. Depending on who you talk to, the South ends at North Carolina, so it
Yeah,
really depends. But I think, to your point,
yeah,
there's still historical
hmm
instances and contexts that make the work very similar to the work that is happening in the quote unquote South, and it's just
yeah,
important that we are doing this. So it seems like throughout your journey, and we'll get into the journey, that you
hmm
have really become an advocate for wanting to give back to your community. How did that come up as part of your story and your journey?
Yeah, it's just being reflective, right? Just being reflective and just understanding my own journey, sort of as I mentioned, and just broadly speaking, like I grew up, pretty poor, grew up in poverty and recognized like my own experiences, and even like later on in life, trying to become like okay with the experiences that I endured growing up. But being a person who again had to access public health systems for my primary medical care, and being a person who had to access other social services that were provided, by the government or by different community-based organizations. And so, recognizing the sacrifices that my family went through to ensure that I was good, that I was in a good place, and that being able to create a sense of stability to move me forward, to be able to access my education and all that good stuff. So I think just for me, it was just sort of one of those things where I just had to pay it forward in a way, and make sure that for people who, I can't change the systems by myself, and just recognizing that for the people that are coming behind me, if I can provide a better experience for them, I'm happy to be able to do so. And those that and even reframing that those who are behind me and those who are beside me, like why can't we just create a better community for all of us? And so that's really just the kind of the mission, the drive of sort of the work that I do and where I am, and just being able to just always think about putting community first and recognizing that we're stronger together, and that I'm always again willing to reach back to be able to do what needs to be done for the greater good.
And throughout your experiences and your journey that we'll get into, you have a lot of
Yeah.
experience with engagement, capacity building, and technical assistance. Can you talk more about this and maybe the importance of it?
Yeah, it's so important. And I'm a person that's going to talk very frank and very direct. So I hope not to offend any of the viewers or the listeners here. But again, I have a public health background, but I also recognize the limitations of public health, right? And so I recognize that I have experience working at the state health department, and I have experiences of seeing the inner workings and the nuances of that, and just the ways sometimes where the way that systems and protocols and processes are set up that is not conducive to actually truly helping people, right? Sometimes it makes the problem worse. So for me, I think that it was always important for me to understand the context that I was working in, and realizing that I myself have skills and perspective that can aid in the benefit of like maybe teaching somebody else. And then there are other people who represent different communities and different identities who are able to do the same. So for me, I've become very skilled at understanding the needs of different folks. But I think the biggest skill that I think I learned along the way was being able to identify other people who could be put in certain positions to be able to teach back, to be able to help, to be able to create spaces to like for learning and for self discovery and development for people who are ultimately going to be responsible for whether it's counting the widgets or it's going to be responsible for pushing the papers. That's going to make for more funding to come downstream, to make for better programming to come downstream. We don't want those same people to also be the barriers, right? So for me, thinking about community engagement, technical assistance, and that kind of work, it's been really important for me to be able to push for people who represent those communities, and people who are actually doing the work, people who know who they are and who their identities are, and also people who are completely okay with recognizing that their own identities sometimes are political, but that's not a reason to ever like speak up and to say what needs to be said, because that's going to make the difference between someone who does meaningful work for the community and someone not ever getting the message and continuing to do harm to communities. So my philosophy around public health is very, again, community centric, and very much about like not tearing down the efforts of public health and public health systems, and especially like health department workers, but it's really about continuing to empower communities to help to educate others. Because really, depending on what space you work in, but I specifically working in HIV, like the community is where the solution lies, right? As we're moving towards ending the HIV epidemic.
Yeah, absolutely. Couldn't agree with that anymore. And I think like to the point of like we need to, because all of us have a part to play in the larger system change efforts.
Hmm.
But to your point, some people aren't given the opportunity to have capacity to know how to do the certain things to be as impactful as they can be. And as I think you said, they become the barrier or they become the bottleneck in the work. So it's how do I identify those people that are parts of the
Yeah,
communities that have those skill sets, and we can really like foster and build that so that there is more
yeah.
collective power and more community
Hmm.
driven power. Because as we all know, to unfortunately, systems are the way they are because
Yeah.
many times we haven't had those people that are most marginalized given an opportunity to be a part of the solution. So it's how do we get those voices?
Right. Absolutely. Yeah, and so I mean, and there should be more opportunities for that. I mean, had the experience of doing work across different spaces, particularly like federal partners and working with other funders. And really, that is the push. The push is really around ensuring that there's more opportunities for direct funding that's based on like capacity building specifically, but just being able to like cut out that middleman sometimes and realizing that again, if you're able to fund grassroots entities, grassroots organizations, or people who are just, maybe don't even know that they are a systems changer, right? Or that they are a public health leader yet. But if you fund those people directly, maybe that is where your solution lies, or maybe that is where your cure is, right? Depending on, what, again, your thing is in public health. So it's so important. And that's kind of, again, just ingrained in my advocacy, right? So it's doing more than just being very focused on that one thing, but it's really about advocating for that systems change all across the board.
Absolutely. And in your work, you do a lot of, you shared you do like HIV advocacy work.
Correct.
So, in understanding that and in understanding that you're trying to build the capacity of leaders, how do you go about identifying those leaders and what does
Mhm.
support look like?
Yeah, so support really looks like I think it just really honestly starts with empowerment, right? It starts with empowerment from the beginning. I think it's important to name that because working in HIV, you can't talk about HIV without naming sort of the elephant in the room, right? And that being that HIV is a condition that impacts in a major disparity young black men who have sex with men, young black men who have sex with men, particularly across the South. It impacts people of trans experience. It impacts black women. It impacts all these people in different ways. And it's further exacerbated by just the construct of stigma, right? And just how stigma just rears its ugly head in so many of these spaces. And so a lot of times, the reason why there's not as much advocacy and not as much like good that you hear coming out in the world about HIV is because HIV has been stigmatized so incredibly bad, right? And so I think part of my own personal process is really just starting with empowerment, right? Just starting with recognizing and seeing people just as they are, and that also means the people who are people who are either living with HIV or people who have kind of stood up as an ally and an advocate for people living with HIV, but who are often kind of bastardized and kind of like pushed down because of the stigma around HIV and the nature of the work. And so really it's about just seeing those people as they are, and being able to empower them to be able to show up, just to continue to show up, And what I mean by that is, again, overwhelmingly, the HIV epidemic is attached to people of trans experience or people broadly of the LGBTQ I spectrum. So it's like these are people who we talk about are just marginalized just in general. So right, even in their day to day life, how can you expect them to show up about this thing on this other thing when their day to day life sometimes is hard enough. And I'm saying this as a other. I'm not sure why because I mean I'm including myself in this as well. Like so in our day to day life sometimes it's pretty hard. It's hard to even show up in some spaces, and some people have privileges even within this community, right? But even beyond that, there are people who don't, but that doesn't mean that they don't desire like dignity and require dignity and respect, and again, just the support to be able to make those changes and move the needle forward in the communities that they want to serve.
And that's a function of the system as well, right? Creating processes that make it hard for people that are living life to really engage with. So, definitely know the importance of building that capacity and just supporting people and being long-term advocates and community voice around certain topics for their communities, because that's how we really get to some level of systems change.
Yeah.
And shifting a little bit here, what does public health mean to you?
Ooh, public health, public health, public health. So I guess to answer that question, just sort of on the fly, public health means to me just another opportunity for access to care, particularly for people who may not be able to access it through traditional norms, meaning like folks who don't have access to insurance or maybe just don't even know how to navigate the system, the medical care system, and know what things are really available to them. I mentioned before that I am a person who grew up utilizing the public health system as my source of primary care. Meaning, as a kid, when it was time to go back to school and I had to get immunizations, I got my shots from the health department. I had probably been to dental clinics before I can't even remember. Because it started so early for me. And that was, no fault to like my parents or anything, but that was just a result of the condition, the social condition that we were within. And so, public health just to me means an opportunity. It means an opportunity for access to quality healthcare. And that's with the caveat. That's when it's done right. When it's done right. And so, there's so many different things that go into it. And I'm talking about this largely from like a medical care perspective, but there's, the even broader aspects of even down to like our day-to-day drinking water, right? And the ability to have access to good, high quality, clean drinking water, which we know some communities don't have, particularly some communities of color, right, in the South, right?
Mm-hmm.
So it is about just realizing that there's an entire, the public health just represents an entire system, and a system that ultimately is is meant to be for the benefit of everyone and to serve all, regardless of your socioeconomic status.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Well, thank you for that. And how would you say that your lived experience as a Black gay male in the South intersects with your understanding and the work that you try to do and want to do in public health?
So I think, like, for me, it is always just making sure that I'm showing up as that voice that continues to advocate for public health. So even, and again, I guess maybe I'm a person that can say all the things about it, the good, the bad, and the ugly, because I have the experience of, again, working in different spaces within public health, whether it's at the community level or whether it is at the actual like health department level. And so for me, it's just about taking that and recognizing that no matter what thing, maybe in, let's say in the HIV space, for example, that I'm advocating for, that it all always goes back to that system. Because like, I'll use this as an example. We always talk about sexual and reproductive health, and there's such a difference of like quality of services that you can get depending on like where you access care. So the type of care that you may get from a private provider versus the care that you may get from a free clinic versus the care you may get from a health department could vary like so vastly differently, right? And so with that being said, it's important to be able to ensure that whatever the next new initiative is by the federal government, or whether the next best thing is, that we recognize that there are some people who are never going to walk into a doctor's office, right? There are some people who are never going to walk into, this mobile van that might pull up or whatever. But some people may actually utilize the health department. And so just knowing that and recognizing that health departments and public health systems just need to be in a position to be able to care for all at the highest level of quality.
Yeah, I appreciate that, and definitely is necessary to understand that, because to your point, a lot of people have traumas and feel a certain way about hospitals, health systems have not being treated as well, and maybe it is the public health department that feels like their medical home in that community. So Those are definitely some nuances that are important to take into consideration. And you began your collegiate journey and got a Bachelor's of Science in Psychology at Virginia
All
State
right.
University. Walk us through that thought process.
First things first, go Trojans. Shout out to the home team. So I would say that as far as that journey, what kind of led me there was just, I don't know, just in full transparency, I was running. I was trying to get away from home. So, I ended up having the opportunity to be able to go to college and to be able to go to my, illustrious HBCU. And with that being said, I think that really set this journey forward about what was to come. So I went into this actually like not really knowing what I wanted to do career wise. Like I decided to study psychology, and even my decision to study psychology came sort of like as an afterthought because prior to that, all of my interests and even my high school accolades had been around marketing. So I actually started off doing a lot of things in marketing. I was part of the marketing club. I went to district competitions, won first place in my category. Like I was a beast when it came to marketing, right? And for me, and maybe this kind of like took on a more personal approach, I realized that instead of at some point in time, I realized that instead of like being intentional about like pushing a product to people or selling products to people, what would it look like if I reframed and took everything I knew and decided to sell behavior change to people, right? Because when you really think about the nuances of what psychology is and what psychology does, and particularly in terms of like social psychology as it relates to marketing, it's the exact same thing. So instead of like selling a product, I can promote behavior change. And that was something that I learned probably my sophomore or my junior year of undergrad, and which ultimately led me towards public health. And coincidentally, and at the time I didn't even know this because I wasn't as like researched about the entirety of like my psychology department at my university. But we actually were one of the few HBCUs who had a doctoral degree in a public health related field. So though the degree is not a traditional like DRPH or a PhD in public health, they actually have a PhD in health psychology with concentrations in community and behavioral health sciences. And so what I again later realized was that all of my professors, they were teaching these undergrad courses, but when they were leaving their undergrad courses, they were going to do research, and all their research was based in public health and the chronic disease prevention and all of these types of things. And so once I learned that, I got super duper interested in what that looked like, and I went on to like sort of figure out what opportunities were there for me to be able to enhance and to take that little like light that I got around public health and make it better. Because at the time, I don't think we had like a minor in public health or anything like that. So I really had to make my own experience. And so I was fortunate enough to get an internship. I did a summer research internship at Virginia Tech. But they had a partnership with Virginia State, largely because they were trying to recruit more Black students to be able to apply for the graduate school. And so, I was able to get some experience with research and experience working with other public health professionals while there. And then when I came back to my university, I was also able to engage in research with some of my professors there around other public health or health sciences related topics. So, yeah, so that was sort of where I kind of got my start and really started formulating and sort of refining what my public health journey was going to look like.
Well, thank you for walking us through that. Definitely very helpful and gives us some insights. What did that research look like that you had at Virginia Tech?
Yeah, so it was really systems based. A lot of it was systems based, which I guess it kind of connects, right? It makes so much more sense 10 years later, like actually 12 years later now. But what the work that we were doing was really about focusing on the public health workforce. So here in Virginia, they were very interested in putting together or doing an assessment of the public health workforce and where folks were educated and what kind of services were needed across the state to ensure that public health, like highly educated people involved in public health or public health schools and education was accessible across the state. So that meant whether it was the larger urban areas of like Norfolk and Richmond and Northern Virginia, but that also included the poorer rural areas, maybe out west, out in the mountains. So that meant ensuring that there was a public health pipeline, as they would call it, to make sure that, folks were able to have a pathway to be formally educated and then also go back to these respective communities to improve the health of said communities. So, yeah.
And what was the overlapping experience, or maybe what was your experience being at a HBCU and maybe learning about psychology and then maybe a little bit about public health? How did that maybe change your viewpoint, perspective, lens, impact how you do the work that you do today?
Yeah. So I think it just goes back to maybe it goes back to what I already sort of mentioned about just that behavior change piece. So just realizing that everything just really starts at this like social and behavioral level that we even talk about, and for some reason we talk about this in a really weird way, but chronic disease, right? When we think about chronic disease and chronic disease prevention, for example, we definitely silo them. We definitely like compartmentalize these things. Like we talk about diabetes in one way, we talk about cancer, we talk about HIV, we talk about these different things in very different ways. But no one, particularly like in traditional medical systems, they never talk about these things as like a singular issue, meaning that the same pathway towards any type of chronic disease usually is the same, right? So the issues that need to be addressed are like the social determinants of health, right? So, we talk about those things. We talk about income and economic viability. Whether it's even like opportunities for education, whether it's family structure, the jobs that are available in your neighborhood, and all these types of things. And so like when you talk about like, oh, actually, and the biggest one that I didn't even mention was even around like mental health, right? Mental health access. So, we always talk about, oh, like someone, maybe is living with diabetes because they didn't necessarily have the best diet because, they don't make enough money to make ends meet. But that's really the same thing for most other chronic conditions, right? So it's when you really are in a position where you're able to focus and hone in on that this is all behavioral, right? This is all behavioral, and there's an opportunity to really get at the front of this, and that's why I'm really big on my role also as like a preventionist, because so much of this is about treatment, right? But once you get to a point of treatment, it's already too late. There's treatment as prevention, so we want to make sure that this never happens to anyone else again. But there are so many opportunities before that point to be able to get there. So I think for me, that's where that was the highlight, right? That was the highlight of once I knew that, and once I realized that, so much clearer for me that from my experience in studying psychology and learning about behavior and learning about like social indicators and characteristics of communities, that that is something that is always going to be critical to the work that I'll be doing moving forward in public health.
And you mentioned that you were a marketing beast. Do you still apply a lot of the marketing things that you learned in the public health work that you do?
So yeah, actually, I have. I try to pull back a little bit because I do want to be more like public health centric, but it's hard not to be able to do it. In one of my roles, one of my main roles since I've been in the workforce, I was a research program manager at a university here in Virginia, and we were actually doing research studies. We were leading out research studies, and this was an obesity prevention research study that was geared towards young, like college age students, people who were 18 to 25, who were interested in losing weight. So within that program, there were some specific aims that were around making sure that at least 30% of the population of people were identified as men, because it was really hard to get young men involved in like research studies, particularly around obesity prevention. And then another aim was to make it at least 50% minority based. And so, because of that, at the time, I was actually within the priority population of the research study. So I was able to connect with folks in a different way that maybe my other colleagues couldn't. And so, with that, not only being responsible for the entire like assessments and the biometric screening process of the research study, I was also responsible for the marketing and recruitment pieces of everything. So within that, I had the opportunity to like build out an entire like marketing campaign all around getting folks into our study. And so, I was supported, by being told I could take my creative liberties and do what I needed to do because I understood the work, I understood the program, and I could, creatively think about how to get people in the room. So that meant running, ads on buses, creating like different graphics, creating different like mini campaigns and social media based campaigns. It included doing radio drops and included doing so much. So to the point where, I could be riding down the street and I could see my work on a billboard, right? Or I could see, or be in the car and hear my radio drop, like, on the radio station. So it was one of those things where I was like, okay, like I see what's happening here. And because of that, I found success. And, luckily it was a success for the entire program, but we were able to actually meet all of our marks and meet all of our aims and never had an issue with recruitment. So not only was, the, the, the check, there was a check mark for being able to engage people, but it was a good thing because this was a program that was based around helping people find ways, new and different ways to lead out healthier lifestyles. So it was a win across the board. So So yeah, that's a little bit of my marketing experience and how I've integrated into this public health work.
And I think it's important that we public health professionals kind of develop some of that marketing skills, or someone on the team has marketing skills, because to the point of, we have these big multi-trillion-dollar tech companies that do a bunch of marketing, and we also need to prioritize, how do we market health, how do we market things that are important to people. And I think too often we've kind of maybe not taken it as important, or
Hmm.
done the work that we could have to make campaigns as impactful as they could be. So I appreciate the work that you do there.
Absolutely, absolutely.
And then after your undergrad, you went on to get a Master's of Public Health at the University of North Carolina at Greensboro. Walk us through that thought process.
Yeah, so at the time, and I kind of already foreshadowed to this, but I mentioned that, I went through that summer research intern program at Virginia Tech, and one of the goals of that was to, from their end, was to ensure that they had more Black applicants to their graduate school. And so, of course, I was going to apply to Virginia Tech, but, when I had the opportunities, I was like, oh, I'm going to apply to a different school, a few different schools, and see what happens. And that process was really interesting because I applied to Virginia Tech and I got in. I applied to UNC Greensboro. I got in and I had to make a choice about where I wanted to see myself for at minimum the next 2 years, right? And so when I thought about, this is going to be an experience of like learning and, and working towards matriculating, getting a degree, but it was also about an immersive experience and realizing like, well, between these two locations, where would I get the most immersive experience that is reflective of the type of public health professional that I wanted to be? And so, unfortunately, what kind of happened, or as far as like me being able to rule things out, Virginia Tech just was not reflective of that. I just could not see myself being in, the mountains of Western Virginia for the next 2 years, not being around people who reflected, like from an identity perspective, like of the folks that I wanted to truly serve and wanted to truly empower and make changes and ensure that changes were made in those communities. And so, and that's not saying and not taking away from the concerns and the needs of rural communities, but I knew for me and my experience that just wasn't in alignment. So going down to Greensboro, North Carolina was a little bit of a better experience because it was a urban area that was made up of a diverse, group of people that was more reflective of a lot of other cities that I've been to, particularly cities in the South, where we knew that there was a growing need. And as I kind of started refining my interest in HIV, like it just made a lot more sense to be in Greensboro than it ever made to be in Blacksburg, Virginia, at Virginia Tech. So that was really what led me to UNC Greensboro.
Yeah, I appreciate you sharing that, and I think that that's also a good lens to kind of think through. Okay, I'm going to do my master's of public health. Is the university located in a place that's proximal to the types of community that I want to do work with? And if not, then maybe that isn't the best choice of university. And I think that makes a lot of sense.
Yeah, and even access to like jobs and thinking about what my next few years is going to be like. In rural Virginia, there's not a lot of jobs, and so what would that have even looked like? Whereas going to a place like Greensboro, it just worked out. It worked out, and there was opportunities that were afoot that I didn't even know were going to be available to me. Particularly, being that that's where I was able to kind of start my career and my career in research, which was where I started before I got to like pure public health. And even doing like research and being able to have my first, big boy job be at UNC Chapel Hill, a tier one research institution, that was a really big deal. And, through that experience, I was able to really like refine my community skills, meaning like how to just connect with people and talk to people on a day in and day out basis. And so, through that, I was able to work in a hospital setting and just really work on building those skills to like, interview people and talk to them and get comfortable with folks and make other folks comfortable and be able to just ask them some, sometimes intrusive questions about their health, but recognize that, my role there was to be able to present alternatives to them that would actually be able to help them make better decisions about their health and what their needs might be.
And while you're in your MPH program, you had roles as a graduate assistant at UNC Greensboro and a prevention intern at Children's Home Society of North Carolina. Tell us a little bit about those experiences.
Yeah, so while I was in grad school, I did have a graduate assistantship where I worked in the Dean of Students office, where I was a sexual violence campus advocate. And so what that looked like was being able to connect with different entities around the university, so connecting with different organizations and different departments within the university to do trainings, to talk to them about, sexual violence sort of prevention and how to identify the signs of sexual violence and how to support students when they experience sexual violence. Unfortunately, that's one of those things that's kind of like, like when you talk about universities and talk about colleges, sexual violence comes up a lot. There's two factions of that. There are folks who are the perpetrator, and there are folks who are the victims in that regard. And so, there's this idea of, who each of these people are. And so it is really good about being able to educate who these folks are, but also like what leads to these kind of things and how to identify what this looks like before it even happens. And then it's like, when it does happen, how do you even support that? One of the things about working in the Dean of Students office as it relates to that is that kind of represented sort of like judiciary space, meaning that when these types of things actually came up on campus, folks were essentially tried. They were tried, the perpetrators were tried or whatever. And that also meant that there was a certain degree of support that they needed to be able to understand how to navigate that system and to be able to better understand like what happened and what went wrong and, why they're even in this space. So it was a very intense role, particularly for a young graduate student, but it was something that was worthwhile in understanding those different perspectives. And so I also did an internship at the Children's Home Society of North Carolina, where I got to work on a team where my main responsibility was to develop sort of this curriculum to be able to support folks who were substance users, but people who formerly used substances who were also within the foster care system. So the thing about it was just recognizing them in the foster care system at 18. A lot of times folks, they're on their own, and realizing that there's a need for a lot of independent living skills that people just don't learn along the way. So it came from a place of, again, prevention and how to ensure that these people who were recently released from the foster care system, that they were not ending up in situations where they were just not doing well for themselves, meaning like they had access to, different services as they needed them. They had access to jobs, access to trainings, and even just access to like day-to-day living skills. So yeah, it was a really interesting experience above all. And that was one of those things when I got to Children's Home Society that I didn't even know that they focused on. I actually went there originally to get trained on a curriculum that they had, which was called Wise Guys, which was based on like teen pregnancy prevention, but through the lens of teenage men. So that was actually my initial interest in working with them. And so I got to do a little bit of work with Wise Guys, but I ultimately ended up doing the foster care work.
Yeah, that's fascinating. And well, I'm glad that you're able to dig deep into those topics as well. And were you a research associate at UNC Chapel Hill before you graduated, and then an associate program manager after you graduated? Is that how it worked out?
So how it worked out was I started off working as a research assistant. So I was just in the clinic and just focused on like doing the interviews and working with folks. But just not too long into that role, I was able to, and I actually finished my master's degree program. I was able to get the promotion to the research associate role. So working more closely with the PI and preparing, reports and getting everything together for our funder. So that was sort of the scale up after things changed. And even in that space, I was really happy because I was super supported by my former leader who, she ended up leaving. She was, a public health professional as well, but she wanted to go to PA school. She wanted to be a physician assistant. So she left and did something else. And she said, this project is in good hands with you. And she was able to hand it over to me. And that's how that happened.
Okay. Well, thank you. And I'll ask you a question about a little bit more about what you did on that project in a bit. But before that, I wanted to ask if there were any big Masters of Public Health takeaways that you wanted to share with us.
Yeah, no, I mean, if whoever's listening, if you're thinking about doing it or you question doing it, I say go for it. And I say go for it and do it in a way. I know there's so many different ways to access your education nowadays, but I would say to the best of your ability, do it like in a classroom setting, do it in a face-to-face setting, because the experiences that you get are just so, I don't know, they're just so robust, I guess, for lack of better words. I was glad to be, trained and educated by a group of people who were very experienced, particularly in like community-based approaches to doing this work. So it's, and I think it required me to like even change my understanding of what my MPH program was going to be like. I thought I was going to go in and we were going to talk about specific topics and, try to like, learn those things. But really it became more about like understanding those skills that are necessary. And some of those skills are so, I guess, practical, meaning that like you can't really learn them and embrace them without doing them. So, being able to be guided by people who've done the work, who've been in some of the most marginalized communities. And when I say that, I mean, at least in my experience, the most marginalized communities, even in America, right? So a lot of people have some transferable skills from working on Peace Corps or working in other global environments, but having someone who's telling you about their experiences of working in, East Baltimore at the height of the crack epidemic, just is a different experience, and it really just it frames how you go on to be a practitioner as well moving forward. So that's my nugget. If you can do it in front of people, in front of professors, like do it in a face to face environment, and be very critical about who you're choosing to educate you and to help you guide your way through your public health journey.
Yeah, absolutely. Definitely has to be an intentional decision and a lot of thought into that process, but it could definitely be very, very rewarding. That's for sure. Yeah. So you graduated, you were in the research associate program position, then associate program manager position. Can you just briefly talk a little bit more about those?
Yeah, so well, something else that kind of happened in between, or at the culmination of my master's degree program, was that one of the things with my program is that it was not super focused on like having like comps as a way to like matriculate through the program. But what the program did do was prepare us specifically for certification with as a community health education specialist. So a lot of our preparation was just geared towards taking the test, right, and getting the test and getting those credentials. And so I think I wanted to like highlight that because that was one of the benefits of this particular program that I went through. And I think me obtaining my CHES certification has definitely supported my journey and really helped me along the way. So I think when it even came down to transition to the job in a full-time role at UNC Chapel Hill, it was like, oh yeah, you have your MPH. Oh yeah, you have your CHES. Like you're good to go. You're locked and loaded. So from a place of like recognizing what competitiveness may look like within the public health space and in the public health workspace, it's important to ensure that you are, seeking out all those opportunities to be able to be credentialed and it's one thing to have the letters, but also to know what those letters mean and be able to utilize them in a way that shows up in your day-to-day work. So.
Yeah, that's absolutely a key point. And as it gets more competitive in public health, it is how do you separate yourself? So getting certificates, getting trainings, important. And then even to what you're saying, it's like not even just having the certificate, but being able to speak to it and show how you've like used the tangible skills that you gain from it, which is even more important. So I appreciate you sharing that.
Yeah, absolutely. And so, that was the natural transition into working with UNC Chapel Hill and doing that work. And so the work that I did at Chapel Hill was based on a colon cancer prevention project. And so again, very community oriented. And it was a project that spanned across 2 states. So it was based in North Carolina and South Carolina. And it was about engaging African American folks that were over the age of 55 and helping them to understand what colon cancer screening was about and what their needs may look like and how to access it and have conversations with their medical professional about getting that. So what I found in doing that work was that there were a lot of people who were not as educated about colon cancer prevention and why it was something that they should be screened for. And truth be told, there was a lot of misnomers about screening around colon cancer. So, there was a great opportunity to not only educate, but then to also get people set up immediately to be able to get those screenings, to be able to identify whether or not they were even at risk for a pretty preventable or pretty like treatable type of cancer. So it was good to be able to do that work specifically for a community that we know is so disparately affected by cancers in general, but especially colon cancer.
And then after that role, you shifted to a research associate position at Virginia Commonwealth University. Tell us about that shift and what you do in that role.
Yeah, so that role was the one that I mentioned before about being able to do some of the marketing work and doing the obesity prevention stuff. So, it was a good project. It was a really good project, just engaging, young adults into better choices and around like their weight and around their physical activity. And it was really about identifying whether incentives worked or not to getting people more engaged in their physical activity and in their overall healthcare. So it was really cool. And again, I learned a lot. I learned a lot from the people who were involved in that project. So.
And you're also a program coordinator at Virginia Department of Health.
Yeah, so I would say that is where I really cut my teeth in a traditional public health setting. I was a pretty young man, but I was like, jumping right into this whole public health world, straight to the state health department. And, I guess for lack of better words, I became the man, right? Or I became a state bureaucrat, who is known to be part of the problem. And, with that being said, recognizing all that I was up against, it was very important for me to be able to fight against those things and realize that it was critical for me to be in the space that I was in to be able to make changes or to at least show up in a way that folks had never really seen public health or state health department professionals like show up before, particularly when it comes to working with subcontractors, meaning like our community-based organizations that we were funding to be able to do work in the communities. And so all the work that I was doing was based off of HIV prevention work. So this was during a time where things like pre-exposure prophylaxis and PrEP was coming into view, and we wanted to ensure that we were building up on that engagement and making sure that it was getting to the people who needed it the most. But and even in Virginia, we were based on this project, we were able to offer it for free. But the model of if you build it, they will come doesn't always work. So this is one of those things where we were able to give it free, but we're like, well, why are young Black men who are having sex with other men, why are they not getting on PrEP? And it's because people at the health department weren't listening to where their needs really were. I kind of already touched on the importance of social determinants of health, and particularly for Black gay men or even like people of trans experience, there are a lot of priorities that supersede that of who they're having sex with, right? And the conversation about who they're having sex with. I mean, the elephant in the room is, everybody's having sex, and we know that. But the reality of the matter is that really what's most important? So if someone walks into your door and looking for services, and your only thing you can offer them is an HIV test, is that going to be enough? Or if the only thing you can offer them is a pill that's going to keep them from getting HIV, that's fine. But what about if I don't even have, let alone a roof over my head, I don't even have a nightstand to put my pills on? So why would it even matter if I have access to this thing? So it was really important to do that work. And, again, from two different spaces of one, realizing the needs of the community and hoping to change the system and ensure that processes were made in such a way where folks could get their needs met, but also working with the community-based organizations and helping them to build their capacity to better serve people and to better serve the communities that were most indicated for PrEP and other prevention services.
Yeah, and I think you're hitting on the point of just how important it is for people to have their basic needs met. And we can't assume that everyone has all the things. And I think the biggest example is when people talk about like food classes where they're like teaching people about nutrition education, and they say, no, you can use your oven to do this. And people are like, I don't even have an oven. I don't have a microwave. So it's like, how can you even, they're not even on that same page. Just like, how do you get them those things that they need to actually do the things that they need to have a healthy life? And I think that's one of the things we always have to keep in sight when we're doing public health work. So appreciate that perspective and you being able to do that work as well.
Absolutely. Yeah, it's meaningful work, and it's so important. And again, and it looks different when you're reflective of the communities. It's the communities that you're trying to serve the most. And I will always highlight that in any type of like advocacy that I'm doing. That it is important for representation. Right, representation is always critical. And I think with this particular project, what was interesting was that this was sort of a homecoming for me, because though I was based at the state health department, the services that were being provided was directly to the city and the communities that I was born and raised in. So it was so much so to the point where, you could have someone from the health department go down and try to work with people and they will be resistant to it. But even down to like, oh, well, we're going to pull that person out and we're going to send you in. So I can go to these communities and out the gate, folks are like, oh, you look familiar, or I know you, or where did you grow up at? Oh, that's right here in our backyard. And that changes the perspective a little bit, right? It changes what's going on, and it becomes a certain level of built rapport and built trust that actually aids in, what we're trying to accomplish here. And it definitely helps when you actually mean well. And so for me, it was sort of a homecoming, and it was very personal work because I was able to, again, go back to my home and support the people who I even grew up with and who we came of age together, and just be able to make that meaningful change in an area that that helped to build and make me to be who I was. So it was good stuff.
Yeah, and you've been highlighting throughout the conversation just how important it is to build that trust, because many times the conversations that you're having are not easy conversations, and it has like maybe quote unquote confidential information or just information that's hard for people to talk about. So building trust is one of the first things that's most important in doing a lot of this work. And shifting now to your current role, you're the Director of Health Department Initiatives at the Southern AIDS Coalition. How do you come across this, and what do you do in this role?
I guess just for clarity's sake. So, interestingly, I've actually not even been in that role for the past almost 2 years now, actually. So I've moved on from that role. And however, that role was a role that was also so critical in my journey, though, because it was my transition from the health department space and into more of a community and a regional advocacy space. So it was really about scaling up. So I went from a place of being able to advocate for the needs of people of my state and the people of the communities around my state to now being able to advocate for the needs of people across the entire South. And so that was really important because the South is known for, particularly in the HIV world, known for carrying the brunt of new HIV infections and high incidence rates. And so it was good to be able to shift in that space to really understand the landscape a little bit better and to understand what the needs are. And I guess one of the interesting things about this as well is that I transitioned into that role right in the beginning of like COVID, right? So it was a learning that was happening as far as learning how to do this work differently. So much work, particularly in HIV, is about going to the places and being in these spaces and getting out to the people. But what do you do, and how do you pivot, and how do you support people in the pivot when you can't go to meet them where they are? The number one tenet of public health is meet people where they are, right? But what happens when you literally can't do it? And so I was so grateful to be in that role at a time where we were experiencing this new renaissance of how we even go about doing public health and how we go about doing engagement and how we work with people, and realizing how that has even shifted to today and how advocacy is different and what our needs are. One of the needs and one of the things that I've been able to advocate for while I was in that role was even access to like technology assistance, right? And not realizing that, there was a shift to things like, oh, telemedicine, right? We can go to telemedicine. All you have to do is pull out your phone and, you can talk to your doctor. But what about the people who, one, don't have a phone? What about the people who don't have broadband internet? What about the people who live in a rural community in Mississippi that don't even have broadband access at all?
Mm-hmm.
So now you're talking about grandma has to go to the doctor, but she needs to be able to do telemedicine, and the kids are at home. They need to be able to do online learning. No one has internet. So you're creating there's new problems being created. So now we're trying to already work through this one aspect of the epidemic, but now there are new issues that are being brought up. So I'm saying this to say that, working in that role during that time was difficult, challenging, but rewarding, because it was really about shifting what my own understanding of, what this work even is and what it looks like. And I think that's really shifted and propelled sort of where like my trajectory kind of leads to now, in a way where I'm unrelenting in thinking about what the needs of people are, because we're now in a space where you can't tell people what they need. You have to listen to what people are saying that they need. And that's going to be our ticket to being able to work on getting folks' needs met to be able to address health outcomes.
Absolutely, absolutely. I love that the shift to you're saying and like doing the work, and then are you scaling it up? Now you're thinking about how can we approach this work at a greater level, which is also something that we always think about when we're doing public health initiatives. It's like, how do we get to the populations
Mm-hmm.
that really need the services or support or whatever the needs might be at that point in time?
Yeah.
And then, what is your current role? How do you get into it, and what do you do?
All right. So look, I'm still rolling here, right? So I currently am a senior program analyst for HIV, working at the National Association of County and City Health Officials. Sometimes people refer to it as NACHO, but that organization is really about advocacy for local health departments across the country. So we actually serve all 3,300 local health departments across the entirety of the country. And so, again, sort of in that same trajectory, making the shift from a regional focus, being very focused on the South, to now taking on a national focus, and realizing that there's so many nuances about the different needs of people, depending on whatever pocket of the United States that you may be in. And also, understanding where the role of local health departments kind of come into play. As I mentioned to you before, I started off, back in the day, getting my primary care from local health departments. So now I'm in a position where I'm able to help advocate for local health departments to be able to serve people in the best way possible. So you may even call it a full circle kind of thing, right? And, it's really important work, because though there is a focus on advocating for local health departments, but at the core of that focus is always going to be community. And it's always going to be about what the community needs. So my role includes a lot of capacity building and technical assistance, and it means going to various jurisdictions and working with them on their ability to implement robust and high quality programming that helps to get in front of people to be able to get whatever services they need. So it's not really about getting a pill in someone's mouth. It's not really about getting someone to take a shot, but it's really about empowering people to be able to access the services that they need, you know. And so if those services look like mental health support, those services look like some type of like economic and financial support. Like it's really about how do we create a system where those needs are met to be able to ultimately push people towards accessing better healthcare.
Do you travel a lot for your role?
I travel so much for my role. So literally last week I was in New Orleans. Next week I'm in DC full time for the week. And you know, I've been on a roll this week, this year actually. I've been on a roll, which is why it was so hard to connect with you. But you know, but because of that, I'm so rewarded because I actually get to see so many different perspectives and so many different lifestyles and see how people do public health their way where they live. And there's things that are so influenced by like the culture and the community of a place that we also don't realize, you know. And when I say that, I mean too that, you know, granted, a lot of my work has come from wanting to be very intentional about serving, you know, marginalized communities, particularly like black communities and people, you know, that are connected to the African diaspora, but also, you know, realizing that there are a lot of disparate needs in like communities of like Native American folks, right? And people who live in rural communities, people who live in Appalachia, you know, there's so many different nuances about these different communities. And so when you apply this public health approach to addressing those needs, there's no like one size fits all, but there's a need to ensure that you are working on the behalf of all, you know. So it makes it challenging, makes it difficult, but it makes it necessary to do.
What do you like most about your role?
I love to travel, so I will say that. And it's not like, you know, it's not fun, you know, all the time. I'm not going and sitting on the beach all the time, you know, but it is fun to be able to just go and see people as they are, you know. And I think it really puts that, it kind of almost brings sort of, you know, I guess reflecting back on this empowerment model that I speak on a lot, but it almost says to me that like, you know, I'm glad to be part of an organization that supports me going into communities, not in a way of telling people what they need or what they want to do, but also saying that I think enough of you and your community that I want to come here and learn from you and talk to you and work with you to see what your needs are. And if we have resources that can help you, I'm happy to share those things with you. It is really a getting to the people sort of approach. And so I really love that. I love that a lot. And I get to, like I said, I get to always interface with folks and I get to connect with people. And it actually helps out a lot after being, you know, as I mentioned before, just being in a space of trying to work through and learn how to work through like COVID and all that good stuff. So, you know, being in a space now where we're able to interface with people and see what they have going on in real time is really rewarding.
And you have a certificate in nonprofit management from the University of Texas at Austin. What was the impetus for getting that, and what have you gained from that certificate?
So I'm a person that has always been interested in how understanding the ways that like community-based organizations work and how they operate. And so my perspective, even with my connection to like CBOs and nonprofits in general, is kind of like backwards, right? So before I ever like worked at or was connected to a CBO, I actually was working at the state health department and I was funding CBOs. So whereas when you think about working with a community-based organization, you see it on the front end, but I saw the back end first. And so that made me realize that, okay, like I get how this works, I get where this is going. And so now, you know, I can put myself in a position and see how it goes on the front end. So if I ever decide, you know, on my own that, hey, you know, Darnell, it's your time to go ahead and open up an organization so you can serve the people, you know, that you want to serve, then, you know, I want to feel prepared to be able to do that. So, you know, kind of a 360 approach to realizing how the back end works and the front end works. And you know what, the icing on the cake is going to be the certification that says, you know what, you've done, you know, you've read the case studies, you've went through the, you know, the different scenarios and you see how this works on all sides. You know, I hate to say it, but sometimes, you know, it is about the, I guess what is it called? The credibility aspect of all of this. You know, particularly as a Black man, you know, we don't want to fall into that trap of like, oh, you know, you have to be the best at everything, or you have to be, you know, everything times two, times three, times four. But sometimes we do fall into that trap. But, you know, I want to ensure for myself that I'm never, you know, I'm never left behind, and I want to make sure for myself that I'm always competitive. So I think that was that was the major impetus for going about doing it. But again, it was really driven by my eagerness to and desire to continue just to learn and continue to want to grow, be well rounded in the spaces that I'm working in.
And before we move on to the Furious Five, the last section of the show, I wanted to ask, where would you like to see yourself in the future?
Ooh, I don't know if that's an easy question to answer. It's definitely not. I mean, I will say, I'm usually very future oriented, so this shouldn't be that difficult of a thing. But I guess I will frame it this way: is that maybe my future has already begun, right? My future has already begun in terms of I've managed to make the pivot, not completely, but the pivot and shift towards doing a lot more consulting work. So I have realized that, my experiences are, so I guess so critical and so important that they can be like translated into various spaces. And there are people who need these services that may not be within my portfolio of work and my current job, right? So why should people who could benefit from my knowledge and my experiences have to suffer because my job isn't, able to connect with them or to partner with them? So with that being said, I've had the experience of working with a couple of different entities and doing some direct consulting work, doing some speaking gigs, doing some like supporting like mentorship programs. So for me, it is really about merging all of those things. I have a strong interest in like workforce related things. So like thinking about the public health workforce and really working on how do we continue to strengthen the workforce in a way where we focus on things like representation, we focus on things like standardization and high quality skills and being able to amplify and highlight like diversity, equity, and inclusion. Because again, there's no one's left out in public health, right? Everybody's a part of the solution. So I'm really big on the public health workforce work, and so I want to just bring all these things together, all of my interests together in a way where I can continue to just show up for people and help communities, whether it's through my traditional 9 to 5 or if I'm able to do it on the side.
Love it, love it. Look forward to seeing how that transition or just the growth of your journey goes.
Absolutely, thank you for that.
You're most welcome. And moving on to the Furious Five, 5 questions to ask our guests.
Uh-oh.
So, number one, what advice would you give to a student trying to pursue a career in public health?
Yeah, I would say be realistic. I think the biggest point of advice I could give to a student trying to pursue public health is be realistic, realizing that you can't be so focused on saving the world that you lose yourself. Because doing public health work is a very selfless thing a lot of times, and it's really about how you orient your mind to it. I think it can be rewarding, but you have to orient your mind to be very realistic about what your wins will be and very realistic about what your losses will be. But that doesn't mean give up. So never give up, but just be really realistic about what you're doing.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I would give them the advice of just being yourself. So, even the wording of that question is interesting to me because I would say you can't get into my position, right? You're not me, right? Maybe it's one of those situations of my position was made for me, right? But what I will say is be you and create your own path and create your own lane. So your title may be the same as mine, but your position may not ever be the same as mine. So do what you're good at, do what you're strong at, and represent what you're good at representing. And you will find success no matter where you go.
Number three, what's something you're working on improving in your life right now?
Yeah. So honestly, I'm really focused right now on improving my own health. I've always been cognizant of this weird dynamic of public health people sometimes being like the worst people at their own health. So I try to do really good things to focus on that. So whether it's eating good and being more physically active, and I mean, of course, I work in sexual health specifically. So making sure that I'm a good steward of those prevention resources that we have out here in the world, and being able to make sure that everything's good, and I'm not selling somebody something that I don't even have experience with myself. So that's the
Absolutely.
best thing I got going from what I'm working on.
Love it. Love it. Number four, professionally, do you recommend anything?
You mean like a service, like an education pathway? Like what do you mean by that?
So you can give like people
Mm,
have given advice. People have said like
mm,
networking. People share books,
yeah.
podcasts, things that are interesting.
Hmm. That's a good question. That's a good question. I don't necessarily know. I know. Well, I will say this. Like for me, it was really important to engross myself in like literature and books and things that were related to sort of like the populations that I was serving. So, granted, even though I represent the population that I serve, it's impossible for me to know everything, right? So luckily, we live in a world right now where there's a lot of media that's out there. So me being a person that primarily works on the behalf of black gay men and trans people of color, I love how shows like Pose and Legendary and all this stuff came to the forefront. But even beyond that, there's a entire genre of literature that's about the black gay experience. And so you don't always see it, but if you look for it, you'll find it. So I would recommend books from prominent black gay authors who speak even if it's very in a very nuanced way, that speak about their experiences, because I think through that you'll learn more about people than you will from ever just asking them 21 questions.
That's great advice. Yeah. And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Just be unrelenting. Be unrelenting. Don't stop till you get it.
Love it. Love it. Simple and directed. Thank you so much, Darnell, for coming on and chatting with me today. I enjoyed the conversation and I learned a lot as well.
All right. No, listen, I thank you so much for the opportunity, and, happy to continue, this relationship and maybe any collaborations in the future. But I definitely, more than anything, just want to give a charge to the people who are listening to just be unrelenting. Just do what you have to do and don't stop till you get it.
Absolutely. Absolutely. Couldn't agree with that. And definitely opportunities to collaborate in the future. But thank you all so much, everyone, for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share it with a friend. Greatly, greatly appreciate you all. See you all next week. Peace.